most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
And I'm Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about tennis elbow. What is it? And how to be pain-free in 4 easy self-treatments.
There you go.
I just added that word how.
Yeah.
Did you see that?
Yeah. We're going to be
I
English
think that
majors.
sounds good.
Yep.
All right. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free. We upload every day. Also, you're going to want to join us on our social media channels or on our website, bobandbrad.com. Go to the giveaway section. We're always giving something away. This week, giving away something really cool. We got the VARIDESK Pro Plus
36 inches wide.
So what's nice about this, you can just use it on a regular table.
It's for a computer workstation.
Right. And it's got a very wide surface, deep surface. And you got 11 different heights that you can adjust to.
Right. So you can either sit down in a low chair, you can sit at a stool, a medium height stool, or you can just stand.
Right.
And just adjust it as needed.
And this company is the leader in this area of stand-up desks. So if you want, if you're looking for quality, this is where you want to go.
If you're going to use it a lot and you want it to last for years, this is a safe bet.
This is the baby. Okay, I'm going to actually move this, Brad, while you start talking.
Very good.
All right.
Okay, so tennis elbow. We've got a treatment that it's not a new treatment, but it's effective. As a matter of fact, we did a video on a similar video with the same treatment. And we're going to do one extra edition here quite a few years ago, and we've had numerous comments with people saying, oh, that really helped.
Right.
So we're going to do it again. And this time I did a little homework and looked at the research on this treatment.
Excellent.
And it's very interesting. But first, what is tennis elbow? Technically, it's called, or medically speaking, it's called lateral epicondylitis.
Yep.
So if we take Sam, good morning, Sam. Hi. Anyways, we look at the elbow, and there's the lateral epicondyle. The lateral epicondyle is this bone right there, which you can feel right there. There's usually not much meat over it or muscle, and oftentimes not much fat either, depending on the person.
And if you're having tendonitis, you can feel it when you touch that.
Right. It's very point tender, right where the muscle connects to that bone. And those muscles, what those muscles are responsible for is extending the wrist and opening the fingers. Are all connected. And there's also some of this component. And that's why when you make a tight fist, or you rotate something, or bend the elbow even, that really can be irritating to that spot.
Yeah, any type of, anytime you grip, your wrist actually goes into extension.
Yep.
So when you're gripping a tennis racket, for the name tennis elbow, you're actually gripping the entire time.
Right. And
that's why you can put a lot of stress on that muscle, which attaches to it, narrows into a tendon.
Particularly with the backhand.
Yeah.
So anyway, it's repetitive motion. You don't get it from one swing with the tennis racket.
No.
Numerous swings, or it can be anything repetitive motion where you're working that hand. Even
clipping a hedge.
Sure, you bet.
That would do it.
Even a computer workstation, particularly if you're using the mouse a lot with poor ergonomics, can irritate that. It takes more time, usually probably a few weeks or a month or two like that. Jerking forces, if you have something where it
or
jerks
vibrating forces, would not help it anyway.
Right. So people are, if you're got one of those type of jobs, a labor job where working hand tools is going to affect it as well. So the symptoms, like I said, point tenderness. Oftentimes the muscles in here can have knots or tenderness. They can be tight there. Like I said, getting out of bed in the morning, oftentimes, I know when I had it, be like, oh, it's really stiff, but usually within 10 minutes and working it settles out and it's much better. And then again, I remember when I had mine, if I just bumped it, if I'd be swimming in the pool and the lap lays a little flat, and I'd just bump it, or walking through a doorway, if you just bump it a little bit, it sends you through the roof.
Yeah.
So
it makes you say bad words.
Well, yeah, I didn't want to say that. I'm trying to get away from that.
Okay.
So I'm working on that. So how do we take care of it? What's a simple treatment you can do at home? Well, this started with Dr. James Syriacs. I mean, he's
considered the father of orthopedic medicine.
right, and he's
Um,
not alive anymore. Is that
Right.
correct?
No, he's been gone for, I'd say 25, 30 years, but
Right,
very influential in our field,
right,
and very dedicated to the field. But he came up with a lot of techniques that are still in use today.
right. This is one of them.
And this is one of them.
And there was a study done when he was alive on tennis elbow, and this is a treatment they did. And on the average of the people that did this treatment, it was 4 treatments, and they were pain free.
Wow, that's amazing.
So it could be less than 4 treatments, or it could be a couple more. But it's so simple. It's easy to do. So the first thing you're going to do is the cross friction massage, and we call it cross friction because you do a massage.
It's cross fiber.
Cross
friction,
fiber. I'm sorry. Thank you,
fiber
Bob.
friction massage.
The fibers go this direction of the muscle, and where they connect into that bone, you're going to go to the tender spot. And I usually use these 2 fingers. You can do it however you like, but you go over that spot, and it's nice to get your forearm
I was going to
resting
say,
on
you probably
something.
even have a pillow.
Sure. Yeah,
And-
grab a pillow, Bob.
And you can also do a finger on top of finger.
Yep.
Or fingers side by side, whatever is most comfortable for you, and whichever way you can apply the pressure.
Right. Now, if you just had a hard day working it and irritating it all day long, this may not be the thing to do. It may be better when it's not quite so flared up.
May want to start with ice and ibuprofen,
Right.
something to
Yep.
if you're allowed by your physician to have
Right.
ibuprofen.
Yep. Exactly. But you go on that tender spot and you just work back and forth, and it's not over the skin. You're not massaging the skin. You actually have to push down through the skin. And what we're doing, we're breaking up scar tissue. And the time you do it, now Syriac says you can go up to 20 minutes, right?
Right.
But nobody's
Nobody's going to be able to tolerate that.
Usually what I do when I have my patients do is I say, do it until your fingers get tired. It's usually 2 to 3 minutes, maybe a little more. But you have to do that cross fiber. Can you get in on that, Liz?
And then because you're not doing it the full 20 minutes, you may want to break it up throughout the day
Yep.
and do it. Now, it's not only breaking up scar tissue, but it's also getting more blood flow to the area.
Right,
And by getting more blood flow to the area, stuff heals.
right.
Now, if it's really too tender to tolerate, I mean, you'll start this and it'll start to hurt so bad, it'll get worse, worse, worse. Then you stop and it's too much right now.
Right,
But if you do it for like a minute
right.
and it starts to even out or even decrease a little bit,
Yep.
then you're golden.
Right. I usually tell my patients, look at a clock, and by 30 seconds, it should be, maybe sore at first, but by 30 seconds, it should start to feel a little bit better. And by a minute, it's either like, oh, that feels okay, or there's a numbish feeling.
Right.
And if you get that numbish feeling or it feels better, then you just keep going until your fingers get tired, and then you take a break.
If it is too bad, where it hurts too bad, I even have people ice it, but then I'll also even have them massage the muscle.
Sure,
along,
yep.
because these muscles are often tight too, and they usually can tolerate the massage
Right.
immediately.
Right.
So
And when you get those muscles loosened up, that takes stress off of the injured site, right where that tendon is to the bone.
exactly.
So, and that you can do throughout the day.
Right. No,
Um,
no restrictions on that whatsoever.
Right.
So
Let's get back to the treatment. You've done this until your fingers are sore. There's one more thing you want to add.
now you're doing that every other day, right?
Yes, this
Yeah.
is done not every day, once a day, every other day.
Right.
So by the 4th day, that would be 8 days.
Right.
Or 7, depending on how
yeah,
you count.
depending
it.
how you count.
Right. And then the next thing you do is you extend the wrist.
This way, Brad, right?
Yep. And then
There you go.
Right.
Yeah, turn it. Yeah.
So there's 2 motions, but you end up like this, and you have to have a table that's about this high, so it's not too high. A little bit lower helps, and then you just hold it here. Then you take your other hand. Let me do it here so you can see it. But I want to do it from that angle, and I'll do it from this angle.
Sure. I'm just going to show you. Yeah, I go right below that bump.
Right. That's the medial epicondyle, the
But I'm
inside
still
bone.
below that bump, and yeah, you can go this way or this way, whichever way is more
Yeah.
comfortable for you.
And then you just push that direction, and you just oscillate.
Yep.
Pressure on, pressure off, pressure on. Now, Bob and I were talking about that. There's a couple other very famous therapists, McKenzie and
Mulligan.
They do a similar treatment. We kind of think they might have got it from Syriacs.
I'm guessing. I mean, again, he's the father, and They have little variations of how they do it, but they all seem to be doing the same thing.
Right.
And the belief is that your tennis elbow, it may be coming from the tendons and the muscles,
Mhm.
but it also may be coming from the joint itself a little bit, the pain.
Right. So we're mobilizing the joint to get it back where it needs to be. And again, pressure on, pressure off, 5 to 10 repetitions. Well, you're not going to go for, 3 or 4 minutes, just 5 or 10 repetitions. And then, you can continue to use ibuprofen if that's works for you.
Sure.
But cold packs on there
Yeah.
as much as you'd like to, 20 minutes with a cold pack. So do that treatment. The whole treatment will take 15 minutes if you count the cold pack, maybe more.
Well, if you do 20 minutes or half hour of cross fiber, it's gonna.
Well, that ain't
But
gonna
again,
happen.
it's not gonna happen.
Again, we're thinking up to 5 minutes at the most for cross fiber.
What you could
the
do is
mob.
cross fiber, do the mold, and maybe go back and do a little bit of cross fiber.
Sure,
even.
your fingers
I
got a
mean,
little rest.
if you got, yeah, if you can tolerate it.
Right. So that's it. 4 treatments like that every other day should get you pain free. And if you're not doing it properly, or it's just so bad,
if
you
you have a really chronic situation, it
Yeah.
could take a lot
right,
longer.
then you can try a few more days.
Yeah.
All right.
All right. Thanks for watching, folks.